That's a pretty clever comparison there, and I think it's a very smart point you're making. We definitely want to spend the money in a wise way, and the programs we do have are not spending the money in a wise way, and certainly that's something to look at. But I think the more important comparison that ought to be made is how much money we spend total for healthcare, what percentage of that money goes to insurance companies, what percentage of that money goes to actually getting healthcare. That, I think, is a much more important and crucial comparison. And I think what you find when you make that comparison is that for the most part, most of the money we spend on healthcare isn't going for healthcare. It's just going to make evil rich people rich at the expense of making people suffer. When you have 18,000 people a year being killed basically because they can't afford whatever it is that they need in order to be healthy, you know, we're essentially murdering those people because, you know, social Darwinism is our social construct, and that's not okay. I mean, you can't excuse 18,000 people dead. You can't make that go away. You can't say, oh, you know. And I think it's very funny that we're talking about death panels supposedly that are going to be in these, in the new program, and that's a lie. It's not going to be like that. It's a lie 10 different ways. But then the actual truth about what's going on right now is we have those death panels. People are deciding, oh, well, you know, we're sorry, we know you need this treatment and we know you will die without it, but you can't afford it. So, see you later. It's tough luck. So, let's compare pros and cons of different ways of meeting the problem rather than just point out how dysfunctional the current system is. I think you're right, though. I think we need to really look at the excesses and the bogus way we're running the systems we have right now. It's terrible. It's a travesty of justice. So we need to really look at these issues in depth, and I'd like to do that on the NI4D Issues Wiki, because it's very complicated issues. It's more complicated than we can really get into in 10-minute videos. So thank you very much, and I hope to see you there. Bye-bye.